Hello everyone, this is NainaMD Beverly Hills. Welcome to my show, Fusion of Science and Beauty. As you know, my passion is anti-aging medicine, integrative medicine, and to really seek out what's the latest, greatest in conventional medicine. Today, I've got a fabulous guest. Her name is Dr. Heather Richardson, and there's a subject that we all fear, and that's breast cancer. Welcome to my show, Dr. Heather Richardson.
Thanks so much. I'm so happy to be here.
You know, this is like we were talking earlier. Women have this tremendous fear when they're diagnosed with breast cancer. And as you put it, it's almost like weapons of mass destruction, right? That's how they come in. Like, oh my gosh, what do I have? You know, what am I harboring? And I think looking back in the 80s and late 80s and 90s when it was almost like a death sentence to have breast cancer. And now things have progressed so much. And I think it's so empowering for women to understand that they don't have to live feeling like they're deformed any longer. You do a tremendous, tremendous job in breast reconstruction. And I think that's what I want to educate the audience, is that, you know, what are the techniques and how have they changed, correct?
Well, exactly. Well, people, we've decreased breast cancer deaths by 25% in the last 15 years.
That's
We've made huge grounds, and so many people come in feeling like they are about to die and anything to save their life. But in reality, 85 to 90% of breast cancers are caught in a curable, treatable stage, which is wonderful news to be able to tell people. So we need to be really thinking past the disease and making sure that people have a wonderful life that they're proud to have and a body that they're proud to have after their treatment of their disease, because they're going to go on and live many, many years afterwards. So we have a couple of different ways to take care of the breast cancer. If it's small enough, we love to save the breast and do a lumpectomy. And many people are under the impression that if you take away more tissue, then you'll live longer and do better. But the idea of taking more healthy tissue doesn't make a person any healthier.
And I think that's really important to mention, because it used to be that the minute a woman was diagnosed, she just wanted the whole breast taken away. And we really have made so much progress saying, you really don't need to do this.
We need to
It's
stop.
not going to change your longevity anymore or any of that sort. So, you know, salvaging part of the breast is huge. So that's one huge thing that's happened.
And when someone comes in with a breast cancer diagnosis, one of the first and best things they can do is just stop, take a breath, gather information. It didn't happen in minutes or days or hours, and it doesn't need to be treated in minutes, days, or hours. This is a process that usually happens over months and months and months and even years and years. And to stop and get really good information so that you can see what matters most to you. For some women, they want their anxiety managed. For other women, they want their body managed. Other women want their disease managed, and they want it done in a very healthy way to avoid chemicals and toxins and what is sometimes standard treatment. And they want to try to really lean towards other alternative medicines. So finding a doctor that works with you and respects what your wishes are and gives you really good information is very important to guide you through that process.
No, absolutely. The other main thing is really the technique itself. And you are very well known for the Goldilocks technique, right? In breast reconstruction, after you perform the surgery and even during while that surgery is being performed. Explain to the audience what this is and how is this different from the traditional, typical breast reconstruction that goes on.
Yeah, it's very different. I think it's a very nice marriage, and the name Goldilocks, of course, we all know the story of Goldilocks, not too hot, not too cold. So right now, the choices are, or the standard choices are to have your entire breast removed with just sort of an amputation with a great big line scar and a very flat chest. And that's one option. That's one way, the old-fashioned way that we did a mastectomy. Nobody liked that. It's not comfortable. It's not attractive. Nothing about that is sort of fits with the way a woman's body or anyone's body wants to move or wants to work.
Absolutely.
And it's very easy to perform. It's very cheap to perform, but it's not good for patients, and it's on so many levels. So the alternative and the pendulum swing has moved towards, well, let's save everything. Let's save the skin. Okay, that works. Let's save the nipple. Oh, even better. And then fill that back up with something underneath. And that's a very good option for many women.
And in other words, they would need
Full
to have
reconstruction.
like how implants. Is that what you're
Right.
getting at?
So if we're removing the skin, if we're removing the glandular tissue underneath, and we're saving the skin, saving the nipple, and when we perform that operation, and I do it very frequently, we perform it through a tiny incision about this big at the bra line, so that when you're looking at yourself, it looks like nothing's been done. And many times when we fill that back up with either tissue from around the body, like tummy tuck tissue, or an implant, and we do direct to implant surgery 95% of the time, we have beautiful results.
So in other words, it's different from that. You don't have to have these implants or the expanders that you have to, you hear about the story sometimes with a two-step and the expanders, and sometimes that's a painful procedure in itself, and sometimes it doesn't work.
It can be a very useful tool for some patients. Patients that want to change their breast size dramatically, it's good to sort of slowly work up to that, either make their breasts smaller or larger. But for patients who want to be the same size or maybe just slightly larger with a little lift, we can usually put the implants in right away, and people love having one single surgery. So we've had that's that one step. And if we need to tweak anything by adding a little bit of lipo filler and do fat grafting.
What's a lipo filler?
Fat grafting. So if we do liposuction, lipomodeling, where we pull fat from somewhere from the body, and then if we need to plump an area up,
they can always like lose fat from other places in the body,
it's
right?
It's a wonderful technique.
I'm sure they have no complaints about that, right?
It's a fantastic technique, and we have absolutely gorgeous befores and afters, which we can.
So basically, you get the fat from somewhere else, and then you process the fat, and then you're able to put it back into the breast tissue. Now, does that a lot of the and I'm sure the audience will want to know, does that last? How long does that result last?
It's your own tissue. So initially there's a lot of swelling just from the procedure itself, and then when the swelling goes down, over a few months, some of the fat cells will die away. So if a patient puts in 100 cc's, say, of volume spread throughout their mastectomy flap or around their breast to create fullness or volume, and especially kind of in the cleavage area where most people want it, anywhere from, depending on the surgeon, 50 to 100% can take. Most of the time it's about 70 to 80% take. So if we put in 100 cc's of fat, usually in a few months there's about 80 cc's there.
So does that mean, for example, like, but you have stem cells too in the fat, right? The fat. So that's going to help with the whole, regeneration and all of that. What, in your opinion, when you have done with the fat, right, with the fat grafts and so forth, do you feel that's more natural looking?
Oh, absolutely.
Yeah.
Oh,
that's
absolutely.
I mean, I've seen them, and I
gorgeous.
They're gorgeous, aren't they?
And in the right hands, when it's done correctly, there's very little chance of having lumpy, bumpy areas or what we call oil cysts. If too much fat is injected in any one area, then the fat can die away because it doesn't have enough nutrient and blood supply. And as fat dies away, it creates oil. So you can get little bubbles of oil or little areas of dead fat that create hard nodules. They're not dangerous. They're not bad. They're very easy to see. Right. It's very easy to see that it's not cancerous changes or cancerous problems. However, if you're in the right hands, then you have a very healthy allotted take of the healthy fatty tissue. It's important to know how to do it right, and we know how to do it right.
That's
exactly.
And I think that's really the education part of it. Is because a lot of people think, I can just go and get a fat transfer, and it's not just about going and getting a fat transfer. It's knowing how it's going to be processed. How much fat is going to go in each area? How is it going to go? And is the result going to give me that? How am I going to avoid the complications and so forth? The other thing about fat grafting, what about the dimpling? People always talk about after like a liposuction. That's one of the common questions. I'm often asked, and how do you respond to that? Does it cause a dimpling of the breasts, or a dimpling from where where the fat was removed and so forth? How do you deal with that, and what do you tell and educate patients about that?
The best thing to do is if you have a surgeon that you want to do that procedure on you, to take a look at their pictures and to try to talk to some of their patients. If you can get some names of some patients that would allow you to talk to them about their experience, that's a very good way of getting some straight from the horse's mouth information on what kind of experience they had. Everybody wants to show good results, and that's all well and good, but sometimes it's good to talk to people too. In the wrong hands, you can absolutely get gouging, and you can get areas where if the incorrect technique is used, You can get scooped out areas of the liposuction, and that can happen even to the best of people, a very small percentage of the time, or occasionally, and it can be fixed. You can put, if there's a dimple or a scooped out area, it's usually very fixable in the right hands because it's very small and subtle.
What do you do for that? Generally,
you can do a little filler to that stuff, or you can graft back into that space.
Yeah.
So if you usually, while you're doing the procedure, and I haven't had to do this, but usually, if you can see that there's a little uneven or gouged area, you've got fat right there, you can inject a little bit back in.
So in other words, it's fixable.
Yeah,
it's fixable. You can still have that natural. So really, this procedure is just gives the most natural look. What about does the size of the breast have anything to do with that? Like, let's say if a woman is large-breasted, she undergoes this. Does that just mean that you're just going to have to get a lot more fat for that, or how do you deal with that?
Well, some of it is realistic limitations, and we have to have a really good conversation with that patient to see how does she feel about her body now, and what are we going to have to do to take care of things, and what does she want her body to look like in the future. With the Goldilocks mastectomy, more is better. It's sort of a real estate issue.
That's really cool.
Yeah, so a larger breasted woman or a larger woman who maybe fits in this category of, so we talked about the amputation mastectomy being on one end and then the full reconstruction being on the other end. Right. And by all means, if someone wants full reconstruction, they should have that. They should have as many surgeries as it takes to look exactly the way they want to look. Hopefully it can be fewer than more, but whatever they want done with implants or additional surgery or tummy tuck transfer, if they want that done to them, absolutely they should have that. They should have that opportunity. Mm-hmm. But for some women, they don't have swimsuit model bodies, and they don't want swimsuit model bodies, and they don't want to have 70 surgeries in order to try to obtain a certain swimsuit model, bikini model look for breasts. Right. You know, if a woman is older, and there's no limit to age, if she has an older mindset, whether she's 30 or 70, or if she's heavier and has a certain feeling about her body, nobody wants to have an amputated breast, but maybe somebody doesn't want to have multiple surgeries to try to have a perfect, C-cup size breast when they might be 5 inches tall and 250 pounds. It might not be right for them.
Exactly.
So with the Goldilocks mastectomy, what it does is it takes advantages of the best parts of both. So we remove all the dangerous tissue that could cause cancer, but we leave healthy fat, healthy skin behind, and we essentially draw a breast reduction pattern on the breast. Then the bottom half of the breast becomes an internal stuffing, and the top half of the breast is folded around it in a breast reduction pattern so that it looks like a much smaller sort of a breast reduction breast, but there's nothing in it but healthy fat and healthy skin.
Oh my gosh.
So there's no implant.
Amazing.
There's one surgery. There's no need for any other tissue moving around the body or anything from anywhere else. And for some patients, it's very comfortable. It's not painful. There's nothing that's pulled together or tight. Yeah. And it's a natural way that the body wants to be, where everything is pulled together in a mound here, as opposed to the old-fashioned way, which is like the lid of an eye, where everything is closed and everything is tight in the middle and then pushed out to the side. So you have a lump here and a lump here. Yeah. Many women after mastectomy hate that feeling of fullness in their armpit. Absolutely. And this eliminates it. It pulls it together.
Amazing.
And the great thing about it is that as a surgeon, and you know with your surgery skills, the most important thing you can do is cut and sew. And those are the two most basic skills that a surgeon needs, as far as dissecting and other fancy things that we do later. But that's all you need to be able to do this procedure. So any doctor anywhere in the world can do it just with a scalpel and a needle and thread and suture material. Amazing. So you don't need any special training. You don't need a plastic surgeon. You don't need expensive equipment or implants.
You just need to know how to do
just
that.
Exactly.
It's sort
Anybody
of like
can
the
do
instructions on really how to do it and read about it.
And any patient can ask their doctor for it. And all that doctor has to do is just look at the instructions, read the paper,
and be able to cut and sew, like you said, right?
Exactly. It's so simple.
What is your website, by the way? How do people look you up and so forth?
Absolutely. It's we're at Bedford Breast Center in Beverly Hills.
I know, you're right next door to me.
Right next door, which is great. We're neighbors.
Yeah.
But Bedford Breast Center or bedfordbreastcenter.com or Heather Richardson. Any of those things will get you to me.
I know. You've been practicing. You don't look it, but you've been practicing for about 15 years now, right? Mm-hmm. Yeah. Listen, we're going to be right back. We're going to take a break. This is NainaMD, Beverly Hills Fusion of Science and Beauty. Hello, everyone. This is NainaMD, Beverly Hills Fusion of Science and Beauty. Welcome back to my show. And we were discussing with one of the most amazing breast surgeons in Beverly Hills, Dr. Heather Richardson, about the Goldilocks procedure, correct?
Right, Goldilocks Mastectomy, yes.
So tell me a little bit about here, in you know, when you were talking about a lot of women here, it's a little different, right, from Atlanta.
Right,
Here, women in Beverly Hills want to have a little bit more perfectionism. They want a little bit more of the perfect breast and so forth. But how are you educating them? Because what I'm finding out, at least a lot of my clients, they're choosing, maybe they made those choices earlier to have the most perfect breast and have the implants. Many of them, and I would say a majority of them, are now at a certain point in their lives want them out.
We're seeing more and more women want a more natural look.
Right.
Yes.
So how are you, without, you know, influencing, but at the same time, how are you educating that, you know, women are starting to wanting that more natural look, right? Rather than the perfect breast, but it looks like you've got the implants.
Right, and I have some patients that are very much against artificial material. They don't want implants in their body, and they don't want extensive surgery to take tummy tuck tissue or tissue from around the back. They just don't want multiple surgeries and have their body mutilated in that way, if you want to think about it that way. And so this is a nice alternative to give to people. Now, everyone's possibilities are different because their breast size and shape is different, the amount of fat on their body is different, and ultimately how large we can make them is different, but we can always plump it up with fat grafting.
See, that's I think that's the most important thing. People really need to understand
so
that we've
much
now
potential.
got fat grafting. Yeah.
This has been very popular in Europe, and it's very popular in the East Coast and the Midwest. And actually, I just was teaching this technique to the American Society of Breast Surgeons in Las Vegas. So we have a workshop where I taught other surgeons the techniques, and I had many surgeons coming to me saying that this was a very popular option and that patients really wanted this, that they didn't necessarily want full reconstruction and didn't necessarily want amputation, and especially for larger patients that are usually older, that have more body fat, they just don't do well with multiple reconstructions. It's just very hard to recreate a breast with an implant. But yet if you use your own fatty tissue, it's warm, it's soft, it's all natural. And then we can choose to make it a little bit better. And then some surgeons have taken it a step further, and we're keeping the nipples, we're saving the nipples.
That's what I was going to come to
which
next.
Is fantastic.
So let's talk about that.
Right.
Because this really brings us to, so again, back then, it used to be that sometimes the nipples are gone, or even the breast reconstruction didn't include reconstruction of the nipples.
95% of what I do now is nipple sparing and direct to implant mastectomies is what I'm doing right now with my practice.
So when you say direct, explain that.
So direct to implant. So we mentioned before expanders. So that's the two-step procedure where the breast tissue is removed and an inflatable balloon is placed underneath the skin, or usually underneath the muscle, and then that's slowly blown up over a few weeks to months to sort of stretch the skin and muscle out.
Right.
And we used to have to do that because we didn't save skin and we kept everything very flat and tight, and we had to stretch everything back out again in order to create a breast mount. So we kind of got into our mindset, well then we have to do this every time for every patient. But if we're leaving the skin and we have all of that volume there and we're leaving that behind, what are we expanding? What are we stretching? If all we're just going to do is keep what we had, or make it a tiny bit bigger or lifted looking. So Dr. Lisa Casselith and Dr. Kelly Colleen, that I work closely with at Casselith Cosmetic Medicine, we've really teamed up, and they've really championed this direct to implant movement. So we put we remove the breast gland tissue. That's my role, and then the plastic surgery colleagues step in and put the implants in at the same step, and then usually that's all we need to do, but a lot of patients want a little bit of tweaking. They would like a little fat grafting, a little liposuction, to just kind of plump things up and make sure that the contours are as perfect as possible. And that's a huge gift to people. With expanders aren't bad and they're not terrible, but they're just not needed as much as most people do. And a lot of doctors and patients are given the message that it's unsafe to keep nipples, or unsafe to go direct to implant. And the fact of the matter is that in the right hands, when you're very respectful to the blood supply of the healthy tissue and the skin and the fat, it lives and it thrives and it's healthy, and you can just put the implant in. It did fine with breast tissue there. It should be fine with the implant or other type of healthy tissue too. So we have zero problems with that, with any kind of necrosis or tissue death or problems.
You know what? There's like amazing, I've seen the pictures. It's just amazing. I mean, the audience needs to understand. When I first saw it, and I'm here, I mean, I'm a doctor, and I'm like, I couldn't tell. When the pictures that I saw, I said, wait a minute. Is this really a before and after?
Right.
It was amazing.
They're beautiful.
And the contour, and also the placement where how the nipple area was. It was just amazing. The other thing I want to mention.
You can't see the incisions.
No.
Yeah.
And the other thing I want to mention is that I had on my show. There are also tattoo artists that do very safe. It's not the toxic tattooing that we know about, and they're very knowledgeable about the safe inks that can be used.
Right.
But when they have a little bit to just do they can make the most perfect nipple, just kind of finish that off, and it's really becomes more of a work of art.
Right, for patients that can't keep their nipples, either because they choose, that's their personal choice, they don't want them, they're afraid for whatever reason, or if they have disease involving their nipples and it's just not possible to keep the nipple. There are these amazing choices. You mentioned the Trempealeau Tattoos are fantastic, and there are also silicone stick-on nipples that you can get that are phenomenal and realistic, and patients who have previously had mastectomies and didn't realize it was an option, I highly encourage people to seek that out. If it's too late, your nipple's already gone from a surgery that was done years and years ago when we didn't have these advanced techniques, they can reach out and they can have really beautiful, they can feel really good about themselves when they get out of the shower, or if they're going to be around,
go to the beach,
and the pool and things like that, or with a partner, if they want to have that feeling, they can. And really everybody has the right to be the absolute best they can be. And we as physicians, and I know you're championing this too, have the responsibility to push the envelope and to make sure that we're making things the most comfortable, the safest, the most natural, the most gorgeous, so that our patients have the best outcomes, because they're going to have really long lives. They're going to live for a really long time. So
getting a little bit into some of my favorite topics is, what do you tell patients before a surgery like that? Do you give them, what kind of advice do you give them? Like what things to either avoid, or what things that they need to be, do they need to have any, or can they just come in and just get it done?
Well, I think that if a person doesn't already have a healthy lifestyle, to try to get them to overhaul their life with the stress and the burden of a cancer diagnosis, maybe is not the right time. Maybe use that after the fact. So decreasing stress and making people feel in control of their situation, relinquishing control, small manageable things, small manageable goals are what I try to get patients to do if they don't have a healthy lifestyle. If patients have a healthy lifestyle, well, then I tell them to do more of the same. Things in moderation that make them feel good, laughing, being with their family, anything that nourishes their spirit and their soul. Ideally,
so you recognize the importance that this is what I was just and we had an interview with Dr. Robert Ray. He's one of the most amazing plastic surgeons that I know. But he said the same thing, and we hear it over and over again. Medicine is sort of like, we feel like it's getting sort of there's a sterilization going on. We really don't need that. People like you understand the importance of nurturing, about laughing, about being with families, about the love, and it's about our healing of our patients. We put our intent, our intention into our patients' healing, and I think those things become very important. And when the clients or the audience seek a doctor, for goodness sakes, you guys, seek someone that's like Dr. Heather Richardson, or someone that really understands that all these things are very important. It's not just a procedure. You're not just a vertical technician. That you really take the whole spirit. It's the spirit. It's a mind, body, soul, connection.
Well, I tell my patients, I say, you go to the doctor to feel better, right? If you leave your doctor's office and you feel depressed and dark and judged and criticized and nagged at, then that's not a good feeling. I think that doctors need to direct and inspire, but not, we can't burden people. We need to sort of lift them up and show them pathways of health. So, but it can be difficult too, especially if patients have really bad health habits. So just in general, I love avoiding dairy. I love avoiding sugar. Protein sources are important, but plant-based eating is so much better for the planet. It's better for our bodies. But at the same time, people need protein too, and I don't judge people on their diets.
Which brings me to the subject. Okay, how do you take care of yourself? So what do you like? Give us a typical day in your life, okay? So what time do you get up in the morning?
I usually get up about 6:37.
Okay.
And then and I usually start the day. I hate to say it, with my phone,
of course.
checking the emails and making sure that things have happened overnight in the world, and seeing what do I need to attack for the day. And then I have 2 dogs, so I take care of my dogs, make sure that their needs are met. And then I really try to stay away from.
So like, what do you eat? What was a typical breakfast for you?
I really like oatmeal smoothies. That's my latest thing. I just love them. So just raw oats in a blender with frozen fruit, and then a little spirulina, and then sometimes some any additional like flaxseed or hemp seed or anything like that, just to get some omega-3s. And then I take my vitamins in the morning, but I sometimes keep some things in the car or at my office.
What are some of your favorite vitamins?
My go-tos, if I
what are your go-tos?
Nothing that if I had to be stranded on a desert island.
Yes, I love that.
Number 1, 2, and 3 would be vitamin D.
Yep.
I think it's the most important thing. I think that we are as a human population, we just don't live the life that allows us to create naturally enough vitamin D.
I was in Dubai where I was the ambassador, Olay ambassador, and a lot of the launches were in Dubai. But the vitamin D levels, you would think in the country like in Asia or Dubai or India, these are very sunny countries. They have a very hot summer,
but everyone is covered.
And guess what? The vitamin D levels, most people were deficient. The majority of the people were still deficient, and you're absolutely right. Well, it's probably because they are covered, probably because they're in the cars, air-conditioned cars, and they quickly run into the hotels. Right.
We don't live a life. If you look at Maasai warriors on the Serengeti, their vitamin D levels are about 100, as far as I understand. And when you look at how did we come to our vitamin D levels that we chose as 20 to 40 on a blood panel is usually what's normal. We took a bunch of factory workers in the 50s.
And actually 30, even 40 is okay. I like it like about 50
70
to
90.
70. Thank you. Thank you.
Yeah, 70 to 90.
Because people think that's, and it's, and everyone, I saw articles when we were recommending vitamin D supplementation, there was more articles about overdosing, and I'm like, wait a minute, how is this possible? More people are deficient than they are overdosed.
I'm very much on that soapbox too. I feel like no one is rushed emergently to the hospital with a vitamin D toxicity emergency. It doesn't happen.
You guys, this is like one of the most amazing, but she's conventional and she's talking about it. And really, I think conventional medicine is slowly starting to shift, that they're making the shift, that nutritional deficiencies they do exist and they do really play a role. And it's not just about measuring levels in the bloodstream, it's what's getting inside the cells. What is the intercellular environment becomes very important in a lot of these things. And so, no, it's absolutely right.
I would love to put myself out of a job. I would love to just keep cancer from happening and keep everybody healthy. I would love that.
Yeah. Unfortunately, we're getting a little bit more toxic.
Yeah, but in the meantime, when we do surgeries, we are giving these women these amazing results where they're happy afterwards. They're sometimes even happier. And not that we pretend that this is any kind of a gift.
But at least they don't. Yeah, and they don't have to worry. First of all, they've had their breast cancer. Now they've got amazing breasts, right?
Right.
So look, this is how do people look you up again?
Absolutely. We're at Bedford Breast Center in Beverly Hills, so bedfordbreastcenter.com, or Dr. Heather Richardson at Bedford Breast Center. Any of those terms will get you to us.
Guys, make sure you look her up. She does fabulous. I've seen it. She's one of the best surgeons I know as far as breast surgery goes. This is NainaMD, Beverly Hills, fusion of science and beauty, and we'll be back next week with a fabulous show again.